Welcome everyone to SBT's webinar series. In this webinar, we're going to be looking at contact tracing and your business, how today's IoT technologies can foster healthy environments. I'm really excited about today's panelists and guest speakers, and I'm looking forward to a really engaging conversation with them and with you, the audience. So I encourage you to ask your questions, and we'll do our best to get them answered. So before we kick off the webinar, I did want to take care of a few housekeeping items. My name is Kevin Martin. I am the VP of Marketing at Smarter Building Technologies Alliance. So I'd like to welcome you to this webinar. First and foremost, did just want to mention that, the recommendations, made in this webinar, they're advisory in nature, informational in content, and intended to work in conjunction and in accordance with local, federal, state, and public health regulations and guidance. So wanted to make sure everybody was aware of that and seeking the appropriate resources when applicable. Today's webinar, if as you already know, is on the Zoom platform. If you're new to the Zoom platform, though in the days of COVID, I think we're all pretty familiar with it. We are going to initiate a few polls throughout the webinar, and we're going to open up the question and answer session. So each time I launch a poll, there will be 2 polls in this webinar. A little window will pop up on your screen. You can simply select your answer and then hit the submit button, and it will get recorded. We will review those a little bit later on in the presentation. If you want to ask a question, on the bottom of your screen, you will see a little Q&A icon. If you click that, a window will pop up, and you'll be able to ask your question. So we are anticipating to have a lot of participants. Right now we're at 85 and it's still climbing. So I will do my best to get to everybody's questions. So please bear with me as we move through those. Today's speakers, we have a great panel of speakers. First and foremost, we have Kerri Barton from the Maine Medical Center. She is the former epidemiologist of the Massachusetts Department of Public Health. We have Tanuj Mohan, who is the Chief Technology Officer and Co-Founder of Enlighted, a Siemens company. We have Tony Garcia, who is our Chief Technology Officer at Smarter Building Technologies Alliance. Shane Akernes, who is the Chief Strategy Officer at Smarter Building Technologies Alliance. And we also have a guest speaker who was able to join us last minute, Jason Samuelian, who is our Director of Sales. So we look forward to speaking with all of these folks and really having an engaging conversation on today's topic. So as we set the stage here and enter into this conversation around contact tracing in your business, it goes without saying that COVID-19 has really ushered in a whole new world of unknowns for folks, businesses large and small. And new health guidelines like contact tracing and social distancing, really understanding how these new guidelines impact your business, impact your customers, impact your clients and employees. It's really, really important. And it's with that we really wanted to hit 3 topics in today's webinar. First and foremost, we wanted to talk about end user business concerns and pain points, understanding, navigating these uncharted waters, what's happening on the front lines with businesses. From there, we really want to take a deeper look at contact tracing, understanding what contact tracing is, what it isn't, what's needed for it, why is it done, and how contact tracing and social distancing, understanding what those mean for your business. And then lastly, we really wanted to tackle how can IoT foster healthier environments? Looking at the future of workplaces, how do we ensure that we're creating and fostering healthy, safe, and secure environments for our employees and customers? And how can IoT play a part in that? So with that, I wanted to kick things off with Jason and with Shane Akernes. These guys, they're on the front lines every day working with SBT clients, and I wanted to get their perspective on understanding end user business concerns. And with that, Jason, can you fill us in on what are you hearing on the street?
Yeah, absolutely. Thank you so much, Kevin.
Oh, I think you're muted, Jason.
Thanks everyone for joining. Thank you, Kevin. I really appreciate that everyone took the time out of their day to join us. I think one of the principal concerns, obviously, is as we enter back to the in-person workspace, what are the principal concerns? And there's a lot of polling data out there about this, and some of the polls that I've read and that I've seen on other webinars and other conversations out of the 100% of the workforce population polled, 30% are comfortable going back to work, starting back in. But the other 70%, what are their principal concerns? And 51% of that that number, their principal concern is what am I going back into? Am I going to be exposing myself to undue, unnecessary risks? And what are the protocols in place from my employer in my building that are going to address that? And how can I be assured that I'm going to be safe going back into that space? I think that that's a major concern as we look at office buildings or manufacturing facilities where there is a lot of close interaction amongst team members, amongst employees. Especially in common work environments, we are coming out of the wave of open workspace environments where you may not even have an assigned work area, and that you are assigned it as you walk in. And so there's a lot of concern of contamination, cross-contamination, how that's going to affect the workspace environment. And so that's the principal concern. Like I said, 51% of those polled out of that number, that is their primary concern. Some of the other concerns also, though, do relate to what do I do with public transportation or childcare, and how do I know that those facilities and those areas are going to be sanitized and clean, so that you're feeling comfortable, feeling safe as you go back to traveling. And then, other protocol type implementations about wearing face masks or temperature taking or that kind of stuff, where it may add on additional time frame to getting into a building. If you work in an office tower, for example, and you have 10,000 people in that office building and every single person needs to be temperature scanned, how is that going to negatively impact my productivity levels for my organization? So there's a lot of interesting concerns as it relates to going back, but I think that's really what Shane's going to address in his concerns as well.
Thanks, Jason, for the intro, and thanks everyone for joining us today. I have the privilege at SBT to meet with our global accounts, our national accounts, Fortune 500 companies. And one of the things I found is, regardless of the size of the business, everybody has concerns. The pandemic has accelerated the need to ensure that people around the globe have the necessary technology to do their job safely with minimal impacts to mental, emotional, and physical health. Employees' health and safety are now in the spotlight, where in the past things like energy savings might have been. One of the things I found is, regardless of the size of the business, I found that all the business has had three primary things in common, or maybe even four. The first one is a genuine concern for the health and well-being of their employees, but even beyond that, into more of a tactical response. They're really looking at prevention. They're looking for, and with prevention, it's not simple. I'm talking to the customers, and where we would dig right in the project data in the past, today we're talking about their families. We're talking about, how are their work families and their home families? How is everybody handling coming back to work? How does everybody feel about it? And what we're finding is, when approaching our customers, we really need an empathetic response to the surging COVID-19 inquiries and all the concerns around that, plus constituent education to minimize the spread. We have to be in a position where employers feel as though they're empowered enough to help with the prevention of the spread of COVID. The second thing that has come up time and time again is they're looking for mitigation strategies. They understand identifying, notifying, and monitoring people exposed to COVID-19 is important, but also using contact tracing and proven technological tools to speed the interoperability and collaboration of human resources and operations of a business to ensure that they're doing everything they can do to mitigate the potential losses caused by COVID. And it's just so important that they have the resources to do this, because at this point, they know it has to happen, but they don't know how it's going to happen. And one last point is on protection. You know, containing the spread of COVID-19 and reducing the strain on the employer with highly skilled and experienced technology platforms. We're so excited today to have the team we have here presenting to you. And I believe that's something that we're going to be able to discuss here later in the call. But I can tell you that in the 15 plus years that I've been in capital project business, that our customers are more concerned and more brittle than ever, and we really have to be empathetic with them. But I can also tell you, if there's a light at the end of the tunnel, that light is there's a truly renewed focus on employee health and on safety, and I think it's a really exciting place to be, and I'm excited how these topics will be discussed on the rest of this webinar.
No, that's great. Thank you so much, Shane and Jason, for providing that, you know, in the field perspective from your conversations with clients. And with that, I wanted to launch one of our first polls, and it's really looking at, you know, what are your or your clients' greatest concerns and pain points at present. It's multiple choice, so choose off in your ranking order of, you know, what is the most important for you. So as we tally those up, I did want to steer the conversation on to contact tracing. And I wanted to introduce Kerri Barton. Kerri, she is the research navigator at the Maine Medical Center, and for 8 years was the former epidemiologist at the Massachusetts Department of Public Health. So with that, Kerri, I'd like to turn it over to you to discuss contact tracing.
Yeah, thanks, Kevin. Thanks for having me here today. You can move on to the next slide, please. So what is contact tracing? Simply put, it's a public health measure to control the spread of an outbreak. The goal of contact tracing is to identify contacts and notify them of an exposure to a case of infectious disease, so that those contacts can then take measures to avoid spreading the disease further. In public health, we've been using contact tracing to control the spread of a variety of infectious diseases. For example, something like bacterial meningitis. So if someone's diagnosed with bacterial meningitis, you identify their contacts. Their contacts can then take a specific antibiotic that prevents them from getting that infection. Similarly with hepatitis A, once you identify contacts of a case of hepatitis A, their contacts can get a vaccine that would prevent hepatitis A infection. Next slide, please. So who typically does contact tracing? Usually it's epidemiologists and public health nurses working at state and local health departments. It can also be other trained public health professionals who work in partnership with health departments. So for example, emergency management agencies are really taking a charge with the pandemic right now in creating these large contact tracing efforts. And then even nonprofits who work in the public health sector are helping in this effort. The picture on the right is the Massachusetts State Public Health Laboratory, where I worked for almost 8 years conducting contact tracing for a variety of infectious diseases. Next slide, please. So this is just an example of a very large-scale contact tracing effort. It's a collaboration between the Massachusetts Department of Public Health and Partners in Health. Partners in Health is a really large nonprofit who works on a variety of public health issues. And you should check out their website, and it provides a lot of detail about hundreds of people who are doing contact tracing in the state of Massachusetts. Next slide, please. So how does contact tracing work? Well, first, the COVID-19 cases are reported to state and local health departments from hospitals and clinical labs. So you have a patient who tests positive at a clinical laboratory or hospital. Those positive results are then reported to the local public health jurisdiction. Then epidemiologists at the state health department will work in partnership with local public health agencies to conduct case follow-up, so you don't have multiple people calling the case. Then you interview the case if they're well enough. If they're not well enough, then you may talk to a family member, for example. But the goal is to collect as much information as possible about the case and then who the case was in contact with during their infectious period. For COVID-19, the infectious period is 48 hours prior to symptom onset up until when the case was isolated. When they're isolated, they can't transmit the infection to others. And then after that, there's a very manual process of calling each of the contacts of the case and providing them with information about their exposure and what they can do to prevent further transmission. Next slide, please. So I want to just pause for a minute and define some of the terms that we've been talking about. So the time between infection with COVID-19 and when someone starts to develop symptoms is called the incubation period. For COVID-19, this is about 5 or 6 days, but it can be up to 14 days. So that's why we have that 14-day quarantine recommendation. And then the symptomatic period is when the person is developed, it actually has symptoms, so the fever, the cough, pneumonia. In the case of COVID-19, there's something called the pre-symptomatic but infectious period. This is prior to when the person has any symptoms, but they can still infect others. So that's the infectious period, the 2 days prior to signs and symptoms, and then up until when the case is isolated. There's also something called asymptomatic infection, which happens in about 25% to 45% of people. These people never develop any signs or symptoms, but they can still transmit to others. So that's why we have recommendations for social distancing and wearing a mask. Next slide, please. Okay, so we've been talking a lot about contacts, but who are they? Contacts are people who come into close contact with the case of COVID-19. So usually it's a shared environment, such as a workplace, classroom, in your household, or a place of worship. Or it can be people who travel together in a vehicle or an airplane who are within 6 feet of each other. Or healthcare workers who provided in-person care to a case without wearing proper PPE. And then also when you're out there in the real world, it can be just being within 6 feet of a case for at least 15 minutes. I've also seen for at least 10 minutes during the case's infectious period. So that 2 days before symptoms start through their symptomatic phase. Next slide, please. So recommendations for contacts are really to stay home. They should maintain social distancing and stay alert for symptoms, the fever, cough, shortness of breath, for 14 days after the last date of exposure. So they may require daily monitoring from the contact tracer. This is checking to see if the person develops a fever, for example. And testing may be recommended for contacts in certain situations, especially if they start to develop symptoms. And while the person's in quarantine, they may require social supports, working from home, food delivery, childcare, etc. Next slide, please. So what does this mean for you all? Well, I just want to note this important point that you're not in this alone. Public health authorities are there to lead and guide you. Like I mentioned, there are very large contact tracing efforts happening around the country, all different jurisdictions. So if you ever have any questions, you should contact your state or local health department to see what they're doing about contact tracing. And then if you ever happen to have a case in your workplace, you should work with your jurisdiction in trying to identify contacts because they're trained in this and can help you through the process. And your approach may differ depending on what's going on in your building. So how employees are interacting with each other, how close they are to each other, how much interaction they have with the public, who's coming in and out of your building, and then if you have high-risk employees. So it's very important to work with your HR department on any plans or policies. Next slide, please. So contact tracing is just one of many elements that we need to put in place in order to really flatten the curve of COVID-19. So implementing social distancing and wearing a face covering, testing, quarantine and isolation, and treatment once we have a proven treatment. And then what's not listed here is a vaccine. Once we have a vaccine, we may not need to talk about it anymore. Next slide, please. So I want to point you to some resources. The CDC has a contact tracing webpage for COVID-19 with a lot of detail about their approach to contact tracing. They also have a webpage for businesses and workplaces. It has a lot of great information about reopening. And then OSHA has this guidance document on preparing workplaces for COVID-19. They developed this nice occupational risk pyramid. So you can see where your business lines up on this pyramid. And then there are specific guidelines based on your level of risk. So I recommend you check that out. That's all I had. Thank you.
All right, great. Thank you so much, Kerri. I thought that was a really great way to kind of set the stage for understanding, what is contact tracing? How is it done traditionally and historically? Which seems to be a very manual process. And I wanted to send out our second poll, which is, do you or your clients have a contact tracing program currently established in your organization? Feel free to, check that out. And that was great responses coming in already. So as we go through that, I wanted to turn things over to Tanuj and really look at the IoT aspect of this and how can IoT enable and enhance and streamline the role of contact tracing and so many other things. So with that, Tanuj, I will turn it over to you.
Hey, thank you, Kevin. Let's just start with the next slide. If you look at a human being, we have our senses and we collect information with our senses. We send all this data up into our brain and our brain interprets the data and it learns from it. So the next time we see the same situation, we know how to handle it. And if you look at smart infrastructure or smart buildings or the IoT platform, that is the essence of an IoT platform. It should have sensing capabilities to gather various streams of data. We should be able to have a fusion of that data, be able to send it to a brain, and that brain should be able to interpret that data and be smarter tomorrow than it was today. So as we look at our infrastructure, we need to realize that it has to be instrumented. We need to be able to monitor both the environment as well as the activities in the space. And once we do that, use case after use case comes out of it. So let's move to the next slide. I would like to say that once we have done next slide's fine. Once you have done a truly smart building, COVID-19 use cases come out of it because we were gathering the data, we were understanding what was happening in the environment and what was happening in the space, and we are able to apply it to the pandemic and to a safe return to work. Now, the components of a smart infrastructure are just like the human being. You have senses, you have communication, and you have a brain. We have used the lighting infrastructure, which creates a grid in the building to deploy a IoT infrastructure. And the IoT end node follows the same pattern. It has a brain, so it can be upgraded in the future. It has sensors that it can take information from, do some edge processing, create new information at the edge, and then communicate this data to a gateway into the cloud where you can look at one floor, you can look at the building, you can look at the whole country simultaneously and have a much greater learning. Just like the human being, we need fuel. And the sensors, when deployed with the lighting infrastructure, get their power from that grid, and in return they provide energy efficiency solutions also. So you have an architecture right when it solves multiple problems simultaneously, and we use the energy ROI as the way of getting a platform in that had an application that worked day one. And now we are leveraging this data that we have gathered for new insights in various areas. So let's move to the next slide. So let's come to how this would apply to a safe return to work. Kerri spoke about contact tracing, etc. I came into work today, and what I had to do was register in a calendar when I was coming and when I was leaving, just to make sure that not too many people arrived at the same time and we could stagger our arrival. As I came into the building, I made sure nothing was touched. I was handed a mask, and I wore the mask when I'm outside my office. My temperature was taken, and I was only allowed into the space, if I was not sick. Also, there were a number of signs that were, communicating how we enter the building and we leave from a different exit, so that people are not coming face to face while entering or leaving the building. So this was an opportunity to communicate the new protocols in the space. I was also given one of these, so that I left this on my desk, so that if somebody else came, they wouldn't use that desk till the sign was removed. So when we had cleaning in the evening, they would know that they need to wipe down this space specifically because it was used. So while in the space, we need to, and I'll show you how a smart infrastructure can do that. We need to make sure that social distancing is maintained. We monitor the cleaning, and occupancy limits are enforced. So in a closed space, just like Kerri said, if there are 10 people in a conference room and all talking and breathing heavily, all the occupants in the space are compromised. Besides all the preventative measures that we have taken because of the asymptomatic, and now I learned the word pre-symptomatic nature of the spread of the disease, you will have to do contact tracing at some point when an employee or a visitor has contracted the disease, and you would like to know, who he came in contact with, who he was proximate to, and where and what spaces he might have used that might have had some cross-contamination. So let's move to the next slide. To give you a view of how an IoT infrastructure would do this, I spoke about sensors being deployed in a grid in the closed spaces in the buildings, and we have visibility into the space, and privacy is a huge concern. So what you're seeing here is just anonymous visibility. We have motion sensors around, with every light fixture, and these are not just turning the lights on and off, but they are streaming real-time motion data. As I'm moving my hands around, the sensor above me is picking that data up and continuously streaming that information. And again, it's all about the data, and with enough data, you have future-proofed applications. And what you're seeing here is we are able to identify the hotspots in a space where people tend to congregate and stay in the map above. And just because all the sensors are time synchronized, as people are walking through the space, you can see the consecutive fires of sensors, and you can reconstruct the movement of people in the space. And the view below is what we call motion trails. And these are becoming very effective, just an anonymous way of knowing what's happening in the building, making sure that, one ways can be done looking at the motion trails. You can figure out where people cross each other, etc. And also figure out if a conference room or a cafeteria is being used more than it should be. Let's move to the next slide. So what we spoke was a totally anonymous way using the simple motion sensors that have been around for the last 20 years in the previous slide. But when we create a building IoT platform, it's all about future-proofing. So each one of the sensors that we put up there not only had a backhaul, which they could communicate into the cloud and send their data for a bigger system to look at, but they have a separate radio that can look into the space, and we have used Bluetooth over here. And Bluetooth is available on every cell phone, so an app can be used, or you can have an employee badge like the one I'm carrying. And as this badge moves around the space, it beacons. The overhead grid listens to that beacon and in real time locates that beacon. So you could do this in an anonymous fashion where each badge is given to an employee and there's just a number and you don't associate it with the employee. But the system is viewing badges which happen to be human beings, or they could be asset tags that could be wheelchairs, etc., in a different vertical. And you could look for, both enforcing social distancing, figuring out where they are most violated. And in case I contract the disease, I can look at my code and register it in a system saying, hey, this ID, not me, this ID or this badge, the user associated with this badge has COVID-19, and a message could be sent after a report is run to see what areas this person used and who he came close to. And you can check your own badge saying, hey, is my badge a quarantine badge? And do I need to stay home for 2 weeks because I was exposed? And this can be done in a completely private manner without tying the badge to an individual. Now, this is up to the end customer whether they want to tie the individual to the badge or not. So we are using the same infrastructure that was an energy ROI based platform to do contact tracing in the future, today actually. The next slide. So the important thing to understand is when IoT is done properly in a building, it can solve many problems, and it can create data streams that can be used for, touchless entry, occupancy limits, digital contact tracing, and all the use cases over here. And this was just for a safe return to work. But once you know the environment of the space and what the tasks being performed in the space are, and how things are moving in the space, you can use that data stream to do a lot more with. Thank you.
All right, that's great. Thank you so much, Tanuj, for that. I mean, it is really amazing, what is possible with IoT technologies. And we do have a few questions coming in here, and I'd like to open this up to a roundtable discussion with the panelists here. And one of the things that comes up, and I think you touched on this a little bit, Tanuj, was by collecting all of this data, a few things come up. Where is the data stored? How is it secured? And what do I do with this data? Let's open that up. Tanuj?
Were you looking for a question, or were you looking for me to?
Yeah, that was a question.
Yeah. Okay,
yeah.
sorry, you were reading.
That's okay.
No, so I think with privacy, the EU came up with GDPR, and that law has defined privacy really well, and most companies that have international business have been exposed to it, and it has a framework for taking away the privacy concerns. You have to be completely transparent about what you are collecting, why you are collecting it, and you have to limit the use case for that purpose only. And the last thing you have to do is, once you have this data, who can see it? I don't want HR to see this data for them to know that I come in at 10 a.m. and leave at 3 p.m. And if the corporation can guarantee that who can see this data for what purpose is kept secure, a lot of these things can be handled. And with how strict the GDPR rules are, I think most Fortune 50, 500 companies have learned how to comply and have started to take it very seriously. So during this pandemic, I think people should be a little less scared than they previously were, where apps in the background were tracking you without your knowledge. Now it is explicit. Every app has to explicitly ask for your permission to gather that data and tell you what they're going to do with it. So there are ways of safely and taking the privacy into account to deploy IoT and connected services today.
Okay, terrific. We have another question here, and maybe Tony, you'd be able to chime in on this. The question says, if I want to put in a IoT system like what was described, do I need to replace all of the lights in my building? And maybe you can talk a little bit about integration, Tony, and how that actually works.
Yeah, so thanks. What I would say, is, SBT being an integrator of advanced controls for smart buildings, we understand the complexity of a design, implementation, and integration of a system. And when I look at, the solution here, I can say that does add another layer of complexity to a system being installed and deployed. So, I mean, would you have to replace your fixtures? Would you have to install a new system? That pretty much depends on what you have in place. And I think what's important from my perspective is, when we roll out this type of solution, we have to ensure that we have the proper design everything has to be installed correctly. And this is going to be more important here because we're not just talking about a lighting system or an HVAC system. We're talking about people's safety and tracking that information and analyzing it. Make sure that that information doesn't get leaked or compromised in any way. And so it's just, and also having long-term support. You have to make sure that this system continues to operate the way it was intended. And I kind of look at those things, and I feel like it's pretty exciting to see these buildings starting to become smarter, which is something we've always wanted them to be over the years, and not just lighting and HVAC. So really looking forward to working with our partners to come up with contact tracing solutions for our customers.
I can add a little to that. I think
Sure, yeah.
lighting is not necessary. You can just put in a low voltage grid and it will serve the same purpose. Lighting and the LED retrofit just created a use case that would fund it just based on an energy savings plan. I think that's the only advantage of lighting. Otherwise, we have done a number of buildings where the application was so much more valuable than energy that the grid went in using a low voltage system.
If I may add something, I just had a very similar situation where the customer looked at the energy savings as an ancillary benefit of updating to a smart building system. So the smart, safe building system was the priority, but they did take advantage of converting the lighting as well, because now they see a payback, an ancillary benefit to what the true importance was, which is a safe, smart building system.
Yeah, and I think that is on top of mind. If we go back to the poll that we did earlier in the webinar, asking about clients' greatest concerns and pain points, 59% of respondents said was how to ensure employee and customer safety, and that was followed closely with crafting a reopening strategy. How do businesses tackle these complex issues to ensure that their employees are safe and their customers are safe. And there's a follow-up question here that we just received. For contact tracing, which technology is more preferable, BLE beacon or RFID-based systems?
I can take that. RFID is normally only at entry and exit points. So when somebody comes into a building, but you can't have RFID readers throughout the building. It's simply not practical. So RFID is not a technology that can be used for locating people in real time within 6 feet across your entire space. So I think Bluetooth today is the preferred way of doing it. I'll just add a little bit. The question said beacon. The Bluetooth works in two ways. This tag can beacon, but you could scan for the beacon and you could locate the tag. Versus if this is a beacon only and it is sitting fixed at this location, then my cell phone indoors can listen to this beacon and I can know where I am indoors, and I can use that for wayfinding. So there are two applications of Bluetooth, so people should understand they are different. A Bluetooth beacon, which is fixed, can be used as a marker for a cell phone to figure out where it is indoors. And a Bluetooth beacon that is mobile, that is speaking, can be scanned from a fixed grid overhead, and the beacon can be located. So you have to understand that there are two distinct things we are talking about. So if my phone is beaconing in my pocket in the background, then I can track the phone or locate the phone indoors. But if my phone is in the foreground with a wayfinding app, then it would use a beacon infrastructure that's fixed to locate where the phone is. So they're just two different things. So I just want to make sure that people sometimes confuse both, but they're different and they serve different purposes.
Nice. We have a question here actually for you, Kerri. What is your position on the importance of masks in the workplace? Do you wear them all day, change them every time you take it off, in and out of a private office? What is your position on the safety of elevators as a small contained space, especially in a high rise?
Yeah, I would say masks are a key strategy to preventing spread between individuals. So, respiratory droplets is really where the virus lives for both asymptomatic, pre-symptomatic, and symptomatic people who have COVID-19. At Maine Medical Center, anytime you go into one of the buildings, you wear one mask for the entire day. You get a new mask daily. Cloth face coverings are also acceptable, and washing them daily is also important. Yeah, as far as elevators, you definitely want to wear a mask in an elevator because it's such a close environment and it's closed. Trying to maintain social distancing, I think, is really tough.
Yeah, no, that makes sense. That definitely makes sense.
I think there's a follow-up question to that as well, Kerri, is how do pre-symptomatic people pass the disease if they're not coughing or sneezing? How does that happen?
So believe it or not, when we're talking, we're releasing little respiratory droplets without really knowing it. So there have been studies that show just by communicating with someone, you can pass the infection if you're infected. And then also it's allergy season. So people are out and they're sneezing and coughing, and it's not necessarily because they're symptomatic with COVID, but if they're asymptomatic or pre-symptomatic and happen to have the virus in their respiratory droplets, and then they're sneezing because of pollen in the air, that's how it could be transmitted.
And opening this up to the broader group, there's a question here: does contact tracing violate HIPAA rules? And I imagine that's more on the technology side. If we're tracking these folks, is there HIPAA implications of this?
So HIPAA normally deals with PII and PHI, which is personally identifiable information or personal health information. And so long as you deploy the system that doesn't do either, you will not have to worry about HIPAA. But on the other end of it, from a security of your data and to keep the data secure, I think most companies today are kind of HIPAA compliant. They have the best practices to make sure the data is encrypted at rest, et cetera, et cetera. So people take care of that no matter what. But then the more important part is that we don't gather any PHI or PII as part of the system. And if any PII is ever gathered, it is a completely transparent, voluntary opt-in and used for the specific purpose for which it was mandated.
Yeah, terrific. And another question about, the contact tracing and the use of technologies. If someone leaves their phone on a desk and they move about, does that defeat the purpose of contact tracing? And how do we avoid that?
It does, and that's the reason why the current techniques that companies like Apple and Google and governments can do work, but they don't cover all the situations. It's like you don't carry your conference room. If I were in a conference room and doing this meeting, I would likely leave my phone in my office charging, or if you go into the restroom, etc. You quite often don't carry your phone. And those are the areas where you're proximate to other people in a meeting, or the surfaces you touch might be compromised. So that's the reason at the end, if you did have a smart building, you would be carrying a badge like this on a lanyard and made sure that you had coverage in all areas. But let's say you only did a phone-based system. At least you will know based on I said it's a fusion of multiple data streams and multiple sensors. You would at least know that somebody went into the restroom because the motion sensors told you, and you might not know who the person is. But if it really became dire that you had to know because of a certain situation, you can look at the motion trails, follow the person through the building, figure out, manually, hey, this person was sitting in this office, or the person left the building, and you can look at the video camera and synchronize the time and figure things out. But those will be done as exceptional cases when you have to leverage the data in ways that it was not meant to be used. But the data is there, and so long as you keep the security and the privacy of the data and only use it for exceptions, we can handle these situations.
Yeah, no, okay. No, that makes sense. And through our conversation, we were talking about, putting in the lighting grid to create the IoT digital infrastructure. We have a question here, proving to a client that a particular measure is effective when it comes to retrofitting buildings can be difficult, especially if it involves airflow management. How do you plan to visualize and communicate the predicted impact of implementing both smart and traditional building retrofit measures and their impacts on reducing the spread of COVID-19? And I feel like Shane, you could probably jump into this, and Tanuj, how do you explain the benefits of these advanced technologies.
And you want to go ahead? Yeah.
I feel, it's just education. It's explaining each of the products and how they work and what they accomplish individually, and that working as a system, you're always going to have more success. So in a lot of the cases, you have a customer who likes, let's just say, an air scrubber versus a customer who is looking for UVC direct light source during non-occupied times. What's the value of each? How do you decide what to use, what, when, and where, and how? And it comes back to the engineering that Tony Garcia was talking about, and understanding the space and understanding the occupancy, and putting together the proper system to do everything from scrub the air to provide the proper sanitation lighting, but to do so in a measure where that sanitation lighting doesn't provide harm. It's done during unoccupied periods. And that's where the use of an advanced control system could provide tremendous value, even beyond the values that we're hearing today about the Enlighted contract tracing.
Yeah, no, I think that definitely makes a lot of sense. And there's another question here, and I think it adds on to that, Shane, and maybe Tony and probably Tanuj, you guys can chime in on this. But is there any data analysis provided to come up with insight and recommendation actions to be pursued on the ground, or data analysis should be done by the operators? So as we're collecting all this data, are there recommendations, or are there ways to, have maybe customer reports that say, what, hallway ABC is always getting jam-packed, we need some kind of an alert, something like that?
So it is vertical specific, and we are a platform, and we don't claim to know the business as well as the business themselves. So we have been working with various verticals to figure out what is effective for their vertical. And sometimes it's not evident to us how they would use the data. An example is that if the food supply chain has had to stay online during this pandemic, and there have been situations of infection in the food supply chain. And they're already actually wearing PPE, which is something, it's not obvious, but they were because of the regulations. And they're not allowed to carry keys, phones, or anything else, lest they fall out of their pocket, etc. And so they can carry a badge like this, which could which could locate in real time where people are, and maybe they're hanging outside the cafeteria and a group of them are talking. Now what that person is worried about compliance and making sure his factory is not shut down, and concerns like that social distancing is not being maintained. So when something like that happens, there is a supervisor typically sitting in an office somewhere in the factory. And he would want to get a notification saying that, hey, this area, people are congregating. You might want to go out there and tell people that, hey, stop dispersing, put a sign over there that please, nobody hang out in this space. So in real time, you can continuously improve your situation. So we have worked with recommendations with the partner. When you go into offices today, we have use desk sensors, the same sensor that went overhead and people were talking about, does it have to go in with the lights? No, it doesn't. Surface sensors go under the desk, and they also become beacons for wayfinding, etc. But they can also do desk, like I did this manual system today, but they could also do the hot desking. And earlier you were trying to cram a lot of people into a space, with 70 desks and 100 people. You're doing the reverse right now. You want to make sure that alternate desks are used, and then people are sitting 6 foot apart, and you would do that using the surface sensor. So the recommendations around utilization of conference rooms, we already do. So we can tell you in real time if this is a 10-person conference room, if more than 3 people are using it, we can alert you. So those are some of the things we are doing today. And then the motion trails that we showed, people are using that already to figure out where to put the signs so people can see them because they traverse those spaces, and as well as create workflows and minimize face-to-face
and so
cross
forth.
traffic. Yeah.
Yeah.
So.
Yeah. It is very interesting. And Tony, I think there was something to say too about application development and how do you utilize this data, and go ahead.
Exactly. I would agree 100% with Tanuj. I mean, that's one of the things we've learned over the many years of deploying advanced controls is understanding what the customer wants and needs. A lot of the systems that we deploy, they collect lots of data. They do have all that information, but how you get that data out or how you present it to the customer is something that you can only learn if you understand your customer's needs and how they utilize a space. So one of the things we've been doing at SBT is when we deploy a project, usually it's lighting related. After that project is completely commissioned and set up, we like to come and walk the space with the facility manager. And we've learned lots of different things. And when we go into a space like a food prep space and we walk to that facility, we're walking the facility not necessarily to find out what are the things we can monitor, but we're walking the facility to fine tune the lighting. And we realize as we're walking that facility and we're understanding, why they want this much light level here, why they can shut this area off, or this one has to stay on all the time. We kind of see different things and we understand more of what else they're doing. And as an example, we found out that a food prep company, they have to sanitize their water stations to make sure that after they prepare some food, they wash it down. They have to make sure that that is sanitized. And what they do is they have to have their water pressure at a certain pressure. They have to have the temperature at a certain temp, and then they have to have the water flow at a certain level, and that's all regulated. And what they were doing now is they simply just write it down periodically. And we came to them with a solution where we would hook up sensors built off of the lighting network to monitor all those points. And that way they had, they didn't have to do it manually, there was less error, and then we can have that information for future usage. So definitely you have to understand what the facility is used for and how the people in there operate the building.
Yeah, no, I think that makes complete sense. And looking at that and in understanding what a client really needs and what the role of IoT in a building is, and it seems like the sky is really kind of the limit, with what is possible. But it's really understanding what the client really needs. I'd be correct in that assumption.
Absolutely.
We have a question here for you, Kerri, actually, and it says, who should be in charge and conduct the contact tracing in my building? Do I need to get a medical professional for that?
So I think, like I said earlier, it's important to work with local public health agencies who are doing contact tracing already, and then coordinate your efforts with them and consult with them on their recommendations. So you don't necessarily need a medical professional in your building. Just call up your local health department. They can help you.
And I imagine it's really marrying, the data that's being collected, as Tanuj and Tony were saying, to be able to provide that to the medical professionals.
Absolutely.
Or the contact tracing folks.
Absolutely. If I was an epidemiologist and I had to work with an employer who had a case of COVID-19 and they already knew exactly where their people were in the building, that makes it a lot easier.
Great. More general question here, for the team, and maybe it's just Shane, you'd be able to chime in on this as well. The COVID-19 situation is not permanent, and how would you convince your customer to invest in something expensive for something temporary while social distancing could work just fine?
Yeah, that's a great point. And what it really comes back to is people are scared. They want to understand, is there going to be a round 2 of COVID? They want to understand, how do we know there's not going to be another COVID illness, or another illness that comes around that's like this COVID experience. But I think it goes deeper than that. It's not surface. It's not on the surface. I think what's really happening is Jason made a great point of this earlier in the call to say 30% of people are excited and they're happy to go back and they're not scared. 70% know they have to work, but at the same time, they're uncertain about their safety. And what we're seeing is a renewed focus in health and safety in workplaces. And employers are reinvesting in their people because they realize what an asset they are. And they want their employees to be healthy and to be safe. And some of that health goes beyond physical health. There's even a mental health component of knowing that you're doing everything possible to have that healthy workspace. I think that's really where this is going, and that's where the conversation is. And if the conversation is limited just on COVID, I don't think we learned a lesson as a society. But if the conversation is open as, hey, things like this could happen, and we got to take care of our people, and health and safety is important, then companies will continue to invest in things and technologies and processes that will support their teams.
Yeah, no, I'll just add a little bit to that. One off, it's not necessarily expensive. You know, if you are doing something in a building, most of the cost is in the labor anyway. So, you know, spending a little bit more on the infrastructure that's going to be there for 10, 20 years is the smart thing to do. But again, this is about, you know, selling the fact that you have to move to a smartphone, and don't say all I do 90% of the time is make phone calls, so I need to stick to a dumb phone. Many years ago, I was in a similar situation where in California, the general contractor was looking at it and was trying to value engineer our solution out, because all he was worried about is cost and code. And he was trying to deliver a building. And I said, and again, I was a little dramatic at that time, I said, somebody will die because of your decision. He said, what do you mean? He said, well, in California, we are overdue for a big earthquake, and some buildings will come down. We will be able to tell you if there was somebody in the building and where they were when the building came down. And we could direct the first responders to save time and get the person out, and not go to buildings, you know, that had nobody in them, or go to them at the end. So I said that this is what the data is there. And I went into a building and showed him a live earthquake in Napa, 2 people in the building, they both ran out. And then 8 hours later, somebody came in and did a security check of the whole building. I said, you know, you have to internalize that and not make it about cost and code and, you know, a siloed solution. You have to simply believe that the data will power, you know, the building for applications that you did not foresee, just like your phone does. So.
Yeah, and I think that it actually goes well with this question that just came in. Yeah, how do we show social responsibility to our employees and customers that are showing that we are doing everything that we can do to protect our greatest asset, our people? How do these systems help with that? And that actually goes well with another question from Antonio, is saying, you know, why is Enlighted unique to the Sea of Lighting Grid beacon market?
Yeah, so first off, it's not a beacon market. I just want to make sure this is a beacon. This is a battery operated beacon. It is not an IoT platform. So our sensors that are powered are listening to this beacon in real time and locating this beacon. And it's not an easy problem, because if I face away from this room and there's a room behind me, my beacon would get pulled into the room next door. And if I don't have room level accuracy, it's, you know, social distancing and all that doesn't really matter. If I put you in the room next door with somebody else, all your contact tracing, all your data is useless. So a lot of time was spent in making sure that there is a fusion of sensing that is done at the edge, where we correlate the motion data, we correlate that the room next door is 15 seconds away because I have to walk through the door and walk in, and compute all of that in real time to create what we call is an asset tracking or location system. So it's been about 3 years and multiple patents that have gone into actually figuring this out. Sorry, and there's the second part of the question was.
It was.
Yeah, about employees. How do we make sure that we are caring for them?
Yeah.
One of the simplest things we did was, this was 8 years ago in the first installation we did. We retrofitted the whole space with LED lights. And the next day we got somebody calling and yelling at us about the lights being too bright and they have migraines and they're going home. And what did we do? Because they actually had a whole bunch of cardboard dimming the lights in their fluorescent fixtures. And then they said, come over right now. And I said, no, hold on. Let me log in and I can dim that light for you and I give you a profile that is a migraine profile and your lights will stay dim. The people around them all saw this, that, oh, your lights are dim. Why are they dim? And each one recommended a custom profile. And this was, they were manufacturing folk. And it made them really happy and productive. So these technologies can do things for the occupant. And that's when you get the maximum value. And this was something so simple that they felt that they were a master of their environment when in a sea farm of cubes. So simple things like this is where you make the occupant's life easier, from a touchless entry, etc. to conference rooms are at a premium right now. But if I had a system like ours and I looked at my phone and I said, I need a 2-person conference room, it would find me the closest conference room and guide me there and reserve it for me, all with one click versus, a lot more complicated system. So it is all about the occupant. You have to keep the customer at the center. And once he sees the value, they embrace technology.
Yeah, no, and that is so true. And with that, we've come up to our hard stop at 3 o'clock here on the East Coast. I want to thank all of you for joining us. All of our attendees, all of our participants, Kerri, Tony, Jason, Shane, and Tanuj. Thank you very much for taking the time to share your thoughts and really address this critical topic that is on so many people's minds. I would invite all of the participants of the webinar to keep in touch with us. You'll be getting a follow-up email following this webinar with a recorded session, so you can pass it along to your colleagues and clients as well. So with that, I thank all of you for joining, and I look forward to seeing everyone on the next webinar.